Good afternoon. This is the Thurston County Board of Health for Tuesday, June 13, 2017. I'm Commissioner Bud Blake. I'm the chair of the Board of Health this year. And I'd like to start off by doing introductions. To my left is Commissioner Gary Edwards. To my right is Commissioner John Hutchings. To his right is the clerk of the board, Cece Fontenot. And to her right is the Director of Public Health and Social Services, Shelley Slaughter. And to her right is Dr. Wood, the health officer for Thurston County. And to her right is Romero Chavez, the county manager. With that in mind, I'd like to call the meeting to order and approve the agenda. Is there a motion?
Mr. Chair, I move to approve the agenda.
Second.
It's been moved and seconded to approve the agenda for June 13, 2017. All those in favor say aye.
Aye.
Aye, and this motion carries. And then is there a motion to approve the meeting minutes for April 11th and April 2017?
Yeah, Mr. Chair, I move to approve the meeting minutes from April 11, 2017 and April 11, 2017 public hearing.
Okay.
Second.
It's been moved and seconded to approve the meeting minutes for April 11th, 2017 and April 11th, 2017 public hearing. All those in favor say aye.
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 And the motion carries. And my vote is also in favor. Next, we have the opportunity for the public to address the board. And I'll look out to the audience and see if there's anybody that signed in. If the public, any public, you want to check for me real quick?
Anyone want me to go check the hall?
No? Okay, great. So with seeing no one's here to address the public, address the board from the public, the next department item we have is Art Story from Public Health and Social Services. Give us an update and talk to us a little bit about the Thurston County Lake ALGAE and most likely Summit Lake. Hi, Art. How you doing?
Oh, I'm doing pretty well. And actually, I'm just going to turn things over here to Jane Montrevenning after a quick introduction. And so we do lakes monitoring along with stream monitoring and other things, a variety of different surface water monitoring activities in Thurston County. And as summer is approaching, we wanted to be able to tell folks a bit about some of the activities we're doing and highlight the algae monitoring that we do and also the response strategy that we have when we find that algae blooms are present, and in particular when toxic algae blooms are present. And to kind of highlight how all that comes together, we'll talk about Summit Lake, because that's obviously something that most folks are familiar with, and it's something where, again, when we do all this work, sometimes you have to take action when you find out that blooms are present and they're producing toxins. So we wanted to explain how that fits together and give a little bit of a history on that, because I know we've received questions about, again, what are we doing and why and that, and so Jane will be reviewing that. So without me spending more time up here, I'll turn things over to Jane Montrevenning. She's the supervisor of our resource protection section, which includes the folks that do the surface water monitoring. And so she'll give a quick presentation here on the lakes monitoring program and how the blue-green algae monitoring fits into that.
Great.
So here's Jane.
Hi, Jane. How you doing there?
And the little clickery thing, yeah.
Have a slideshow?
Yeah. Where do I aim it to?
I see the lavender on there. That's pretty cool.
All right.
Someone's gonna fire them on that laptop.
You want to borrow mine?
Technology.
You want to borrow Gary's? He's got the paper.
That'll never get old.
Well, while we're waiting on that, do you guys
Obviously, I am not help.
have the latest test results?
Thank you, Jim. Thank you very much.
Last week's test results.
Oh, good.
We haven't gotten.
Thank you.
There we go.
All right. Thank you. So we want to talk a little bit about our regular lakes monitoring as well as, again, this special situation at Summit Lake and toxic algae monitoring. We do, with funding from our friends over at Resource Stewardship and the Stormwater Program, they fund our monitoring programs for lakes and streams. as well as the cities pitch in some money, and some of the folks that have lake management districts such as Long Lake, Lawrence Lake, also kick in some money for this program. So we have the lakes and streams, we have swimming beach monitoring a little bit, and biotoxin monitoring like red tide. So I'm going to focus mostly on the blue-green algae, but I wanted to just give you the whole layout of it all. So in 2017, we're monitoring 9 different lakes. There's a list. And this is a monthly ambient sampling. The goal of this sampling is to pay attention to long-term water quality trends and get a heads up on any emerging issues. So this monitoring is done out in the middle of the lake, in the deepest portion of the lake. And we look for a variety of parameters: temperature, pH, conductivity, dissolved oxygen, and the clarity with a Secchi disc. We get nutrient tests at the surface and down at the bottom. And then we get a sample for algae, not so much to look for toxic algae, but just to look for are the kinds of algae that can produce toxins in the water column. And then we've got the blue-green algae, also known as cyanobacteria, which is too long to say, so everybody calls it blue-green algae, except the most heavy-duty scientists. And that's where we get into trouble because some of them do produce the toxins, like we have at Summit Lake right now. This is a couple years ago, actually 10 years ago. It's a nice photo. Some blue-green algae looks like a paint spill. It's really dramatic. Sometimes it just looks like a little bit of scum on the surface. It really varies. And while we know what causes an algae bloom, basically the right kind of weather conditions and the availability of resources that the algae needs to grow, particularly phosphorus tends to be limiting in lakes, nitrogen as well, and just lake itself. We don't, however, know what causes the blue-green algae to turn toxic. The very same species of algae that can be floating around looking kind of slimy and green for unknown reasons can produce toxins. And without that predictability or without that knowledge of what makes it go, we can't predict it, which is really quite frustrating for all involved. There is a lot of research into this, but no answers yet. And the kinds of toxins, we can get toxins that affect the liver, as well as toxins that affect the nervous system, and then some skin toxins as well. The antitoxin A that we currently have in Summit Lake is a nerve toxin. Again, symptoms. With the liver toxin, it is cumulative, and all of them can cause death. Hopefully, mostly they don't, but they can. With the liver toxin, it can take a few days, take some time. With the nerve toxin, it can be much more quick, within a few hours or even minutes, depending on the dose. It's particularly a problem, I guess, for dogs because they're out there swimming in it, licking it up, drinking the water, and then licking the algae off their fur. So we do worry about that. So again, our regular monthly testing is out in the center of the lake or in the deepest part of the lake looking for a whole bunch of parameters. Currently, our toxin testing is on a response basis. In 2007, due to, again, increasing concerns about the toxin algae, Department of Ecology, I believe in Department of Health kind of teamed up, but they provide funding through the Department of Ecology to do this testing. It's statewide, and it means that we need to have scum on the water that we test and we send into the King County Environmental Health Lab. They cover all those costs. And the levels we have for what's considered acceptable for recreational purposes are listed there. Again, antitoxin, it's 1 microgram per liter. Microcystin is the other most common one, is less than 6 or 6 or less than 6. The other ones we don't get so often. These are, the report considers them provisional interim, and this is because there's ongoing research. It is still the standard today for our state. And we have a variety of signs that we can put out. So right now, our process is when we have an algae bloom, we go out, staff goes out, if indeed it looks like an algae bloom, they'll take a sample, send it off to the lab. That takes, there's a delay of a few days, as much as a week to get the results back. If that result comes back above the advisory level, then we go back out and post the yellow warning algae sign. We have elected thus far to not post the caution sign. The caution is, it might be present. We're looking at that. The reasons we decided not to do that originally was we didn't want people to basically have sign fatigue and not pay attention to it when we knew we had a problem. You know, that's a decision that's up for looking at. In the case of Summit Lake, when that result came back, very, very high, 354 micrograms per liter, we initially posted the warning sign, and then pretty much after consulting with Dr. Wood, went back out and changed that to the red danger lake close sign, and worked with the Department of Fish and Wildlife to actually close and lock the access gate at the boat launch. No, that's what that says. We do rely on volunteers and the community to report a bloom. We do have some folks on every lake who kind of keep an eye out for us and report, and some of those have signs that they can help us post. That's a system I'd like to beef up a little bit, and maybe have folks check in very regularly to let us know that there isn't a bloom, so we know that somebody's really paying attention, so that we have that ongoing. We also have an email alert system that folks can sign up for, and then when we take the test or we get the results back, we can send that out to the community to let them know. It's one of the ways we have to alert folks. You could get more information either at our website or the Washington State Toxic Algae website, and there's that when they get the results back from the state lab, or the King County lab, that's where they post those, and you could get the whole history of the lakes. They have some nice charts and graphs of, again, choose your favorite lake and have a look and see how often it's had algae blooms and which toxins have been found in the water. So Summit Lake, May 4th, we had several folks call in to report an algae bloom. We got right out there. We typically try to get out there within a day or two. With Summit Lake being a drinking water lake, we got on there really right away. Again, typically we wouldn't send an alert out or post an advisory until we'd gotten the results back, but because Summit Lake was a drinking water lake, we decided to err on the side of caution and alert the residents with our email list, and to go ahead and put an advisory out and send it a media release. We got the results back the following, that was a Thursday, May 4th. May 8th was a Monday. We got the results back with, again, the super, super high levels of antitoxin, and issued a warning right away. Let the community know not to drink the water and not even to use the water for dishes, laundry, showering, anything you would use water for. So again, we sent staff out to put out the warning signs. It was the yellow warning sign at first, then came back after further consultation with Dr. Wood, and after we'd gotten the incident management team going, decided to have that community emergency and post the red lake closed sign, and work with Fish and Wildlife to get that lake locked up, which they did on May 10th. Good. I handed you the map, but here's the various results and where we've got the sample sites. Again, typically with a lake, we would take, one sample would be enough to close the whole, or not to close, but to issue an advisory for the whole lake. Summit Lake being a drinking water source, we've treated this a little differently. We've added additional sample sites around the lake, and we did a combination. Typically, we just get it right from the surface in the scum, because that's where you're going to find the highest levels. We did that, as well as taking tap water samples from various depths to get a feel for that. So those are those results. Last week, the results were all below the advisory level, so that was very exciting. We went out yesterday and got additional round of samples. We've got our fingers crossed that maybe when we get the results back on Thursday, that'll be low. If it's all below the advisory level again, we'll be able to remove the advisory. However, we have had cases last year at Pattison Lake where we had high results. They came down below the advisory level and they popped back up again, which is one of the reasons why we need two weeks in a row. So we're cautiously optimistic, but we won't know until we know. And I think we said that. Yeah, we need 2 weeks in a row to lift the advisory. Websites again. So I think that's it. Any questions?
Great question.
Jane, is there a standard process when you're testing the Department of Ecology or someone that, I don't know, is there a standard? You know, you always dip into the scummy stuff where you scrape the scummy away and dip a foot below, or what is that standard?
Yeah,
It's recommended.
the protocol is to go in where you see algae in the scum and you kind of put the bottle halfway, kind of right along the surface so that the stuff is flowing into the
Suction.
bottle. So it's right in the surface, and they do want to get the scum, or the algae, the visible algae, as well as the water.
And now when there's no, when you can't test it clean or below the level, is there any blue-green algae present now out there? So do you still test kind of a scummy blue-green algae and you don't find anything? Is that?
Well, right now, we've continued to take water samples around the lake whether or not we saw a scum, because of the drinking water lake and the very high levels of antitoxin. At this point, Department of Ecology is no longer willing to pay for those samples that don't meet their protocol of being a scum. So the county's having to pay for those samples.
But isn't the protocol that we sample until the bloom subsides and we get two sets
Yeah.
of samples that are clear?
Yeah, they'll pay for that part.
I guess what I'm wondering is the scum area gone now, you know, sometimes it goes away eventually.
It does go away. Our fellow who went out and sampled this week said he thought he saw some at one of the sites, some scum, so we'll see.
Okay.
But we've been taking samples at all the sites whether or not we saw visible scum.
Okay.
I have a couple of questions. A couple of them you might not be able to answer. This event happening at Summit Lake happens nationally, all kinds of lakes, right?
Yes.
And nobody knows what causes it or what cures it or how it resolves itself. Are you aware of anywhere in the country, though, of any deaths or sicknesses that have occurred because of this?
I would defer that to Dr. Wood.
I haven't heard of any.
Okay.
I went out one night when the water was being distributed at the fire hall, and members of the residents said, "Oh, you should Google Cottage Grove, Oregon, and coroner," and I did because I wanted to understand what they were talking about. I didn't find anything.
Okay.
Because they said that they thought that maybe a young man had died from exposure. They couldn't tell me the year or anything like that, but I couldn't find that information.
And I would think that would be big news if it's happening, not so much in Cottage Grove, but nationally. Now, the question I have is, number one, it's a statement before I have a question. This happened, the bloom reported on the 4th of May.
Mm-hmm.
That's the same day we had that micro cell blast come through and take out a bunch of trees and power.
Okay.
So that was a pretty hectic day, but we're notified that day. Results are taken the same day, and that was a Thursday. And by Monday, we had results back.
Mm-hmm.
I thought the results take like a week. Was that like somebody was jumping for us and getting that done quicker than normal?
The
And now they
results,
take a week?
yeah, the results take usually several days, and we alerted them, the lab, that it was a drinking water lake and it was a high priority. It was also early in the season, and they didn't have any other samples that were coming in.
Okay.
And so again, because Summit Lake is a drinking water lake, it generally does get up to the front of the line. But if, so for example, this week we had a call, we went out to take a sample, not only from Summit Lake, but also from Munn Lake. At this point, King County is getting samples from all around the state, so Munn will have to kind of wait its turn in line.
So is this happening on the 4th, on a Thursday, when it's all breaking loose, at least here locally? And I think we were briefed probably on Friday, and I think we had a pretty doggone good response, pretty quick response to Summit Lake, and I'm very happy with staff, exceptionally happy with staff, and the results coming back so quickly. That's it. Thank you.
Go back over here.
Did we ever get any confirmed information that anybody actually got sick up at Summit Lake, or dogs got sick, or that we could really tell that was attributed to the lake?
The animal reports that I got were generally after the fact, so to my knowledge, at this time, none of the animals were able to be examined, or I'm not even that clear if there's a test or something that you can do, so.
Oh, in humans, it's, at least with this toxin, which is a neurotoxin and acts within minutes to hours, there's not something you can measure. It's not like you can check the level of a poison like cyanide or arsenic. And I wouldn't presume to speak for vets, but I'm not sure what you would necessarily test for in terms of. It's always nice to have the correlation between the circumstances on the outside and the results from a human or an animal, but that doesn't always happen, unfortunately.
And I would say I'm not sure that our advice would have changed. Our advice started out being don't use the water. So had we had some way of confirming an illness from the lake, it would still stay don't use the water.
Do you know, has there ever been a toxic level like we experienced at Summit Lake, 345 or something? Do you know, is it common to get that kind of a number sometimes in certain situations or around the country where this is going on? I see there's been a lake up in Anderson Lake up in Jefferson County, and their test results came back at 1.38 micrograms. And so I'm just trying to figure out why that was so exceptionally high, and if it's common that it can be exceptionally high like that.
I'm not aware around the country. I would say at Thurston County, no, I don't believe we've ever had results quite that high before.
Is there anything, I mean, could you say that you've had them up to 25 or 102, or I'm just trying to get some sense of why this was so high. I mean, first of all, I'm questioning why it is so high, but have we ever had any type of a history of those kind of numbers or anywhere near those kind of numbers?
Yeah, I'd have to go back and look at the data. I haven't done that recently.
Okay.
Sure, I have one question for you, for clarity purposes and from possibly me. So you mentioned in one of the slides you don't know what causes, is it the blue-green algae, or you don't know what causes the toxin? I'm just trying to look for clarity on that.
We don't know what causes the blue-green algae to produce the toxins.
Oh, okay. So I might be a little picky, but put me on my spot. So do we know what causes blue-green algae? Is it septic? Is it feces, animal feces? Is it fertilizer? Any of those things that possibly causes the blue-green algae?
Could be all those things. Basically, the conditions have to be right for the blue-green algae or the algae to grow. So if you think about your lawn in the springtime growing like crazy, everything is right. The temperature's right, the soil, the whatever.
water flow.
The sunlight, the warmth. With the algae, conditions, the fertilizer, septics, manure, dog waste, all
So
the
it-
above can add
Okay,
nutrients.
So it could or could not be either one or all of those? Is that a
Sure,
fair
I mean,
statement?
it would be hard to specify the percent
Oh, yeah. No, no,
contribution
I'm just
from
looking
each.
for,
I
the
would-
source, if there was one at all. Because people were concerned when we went out there, it was septic, and then again, we can't say it's truly septic, but of course, we're always gonna look at the source of the problem, or animal feces, or any other item. It doesn't even have to be those three, we're always looking for it. I was just curious bud here, trying to get to the root cause of this, and so, but it's not been determined. Is that a fair statement?
Yeah, I would say
But a lot of things are suspect.
a lot of things are likely contributors, and
Okay.
I would guess probably all of them have some of a contribution to an algae bloom.
Yeah. Okay, great, thank you.
Yeah, including the sediments in the bottom of the lake, or sediments washing into the lake as well, can carry nutrients with them.
From upland or something like that, or through the
From
river?
up, well, starting at the bottom of the lake, what's already in there, and then,
Right.
yeah, soil particles washing into the water.
So it's a heck of a concoction, huh? So,
Sure.
Okay. He has another question.
Just to follow up to what Commissioner Blake was saying, that is, I don't know if blue-green algae lives outside of the lake, if it would survive, but somebody was suggesting at Summit Lake that we shut down all visiting boaters coming in, because they're probably bringing something in that contributes. Like something probably stuck to the bottom of the boat, like the little frogs or something that's,
Right. It's always a good idea
does
to
it live
make
outside
sure your
the
boat
lake?
is clean before you move it around
yeah.
from water
But-
body to water body, but the blue-green algae is naturally occurring in the system, so I don't know that would make a big difference one way or another.
But does it live outside? Would it die on someone's hull before they put it back in the lake? And we don't know.
I don't know. Somebody may know, but I don't really know.
The life
Okay.
of green blue algae.
Thank you, Jane. Thank you, Doctor.
Any other comments?
No.
Shelley, any comments or follow-up, or Dr. Wood? No?
No,
I was just going to, in response to Commissioner Hutchings' question, there have been confirmed instances where pets have died. So that's why the picture of the dog in the water is the one that we used, is because I think it was actually Anderson Lake.
Yeah, but he's not the one that died, is he?
The dog, well, not that particular dog, no,
Okay.
but it was a Labrador, I believe.
Okay.
And so they're more vulnerable, as Jane indicated, and so there have been confirmed cases where, there was nothing else that could explain the animal's death other than the toxin from the lake, and so using antitoxin. So fortunately, we're not aware of any human cases, but there have been pet cases, and so that's why we're, particularly concerned about, we're concerned about people most, but also concerned about pets and livestock.
Well, thank you so much for what you've done so far and what you're doing, and we certainly appreciate all your hard work out there at Summit Lake and throughout the rest of the county for the other lakes. You bet. The next department item we have is summer safety, and I think Chris Hawkins is going to come up and talk to us a little bit about that. Is that right, Chris? You have a slideshow also?
Want to go straight to summer safety?
Yeah, let's do
Or
that.
Community design first.
Oh, let's go with community design. You're absolutely right, sir.
Okay.
I
Fantastic.
jumped past it.
Thank you very much. My name is Chris Hawkins. I'm your Community Engagement Evidence and Partnerships Manager with Thurston County Public Health and Social Services, and very proud to be the staff liaison to this particular action team of Thurston Thrives, called the Community Design Action Team. And the focus of this team is to really work on making it easier for people to be physically active here in our community. And that effort takes a lot of partnerships to happen. We've been working over the last couple of years to develop a strategy and start to put that strategy into action here in Thurston County. And I'm going to mention some of the partners that we've got involved with this. It includes the local cities that we have here in Thurston County, cities of Lacey, Olympia, and Tumwater, as well as smaller cities like Tenino and Yelm and Rainier, all working together on long-range plans that make our community a more walkable place. It includes intercity transit, the local public transportation provider here in our Thurston County region. They do a variety of projects that have an influence on local active transportation. It includes our own Thurston County government and programs, both in public works and public health, and probably several other departments as well, working together. And it involves some local nonprofit organizations, including Olympia Safe Streets and Woodland Trail Greenway Association, the association that works on promoting the development of our regional trails system in Thurston County. These groups are working together. They agreed back in as long ago as 2013 on a goal of creating convenient, safe, convenient, abundant opportunities for physical activity so that people, oops, went too far on that, people are physically active in their daily lives here in our community. A couple of examples of that are included on that slide, showing a walkable downtown environment and a good environment for walking to school. So you'll hear a bit more about that as I go along through the presentation. I wanted to bring you back to a strategy map that we developed with this team. And that strategy map developed in 2013, 2014, and since built upon and changed over the last couple of years, includes a number of different activities. So this is sort of built on a logic model. You go from the left side of this, which is the strategies and actions or activities that we do as part of this Thurston Thrives effort. And we do these activities such as developing local plans that guide development, that encourage greater density, greater diversity of uses, mix of uses, more destinations close to where people live or where they work, as well as better connections, better facilities to support people walking and being active. We look for things like parks being built in neighborhoods or close to where people live and work. We also look for that good street design. Are there sidewalks? Are there bike paths? Are there other facilities that make it easier for people to cross the street, for example? Those are all elements of walkability. Also included in that are trails. And then programs that support and encourage people to be active or that encourage the development of better walkable designs. And so we have a Safe Routes to School project that works on that. And we also get out there and educate and encourage people to be active. And all of that is done, those activities and strategies are done so that we achieve and build towards those objectives that are in the middle of the strategy map, and then move towards that higher order goal of creating safe, convenient, abundant opportunities for physical activity in our community and eventually reach that really long-term outcome or vision. How would we know that we're getting there? We would know by looking at some longer-term outcomes like levels of physical activity in our community, whether that's adult or child. And we know that a little over half of people in our community as adults are reporting that they're meeting those physical activity recommendations of half an hour each day, at least 5 days a week of physical activity. And for youth, it's lower. Only about 1 in 3 young people in our community are meeting the little bit higher standard of 1 hour per day of physical activity. And so those are the things we're paying attention to as an action team for the long run. We're also looking at how many kids are walking or bicycling to school, because this is an indicator of how much activity people are getting, how much activity kids are getting in particular. And that mirrors the physical activity standard in the community. About 1 in 3 kids are reporting on the Healthy Youth Survey that they do get to school using this active transportation. So we know we've got some room for improvement and making gains in those long-term outcomes. Some of the strategy measures that we've developed include looking at the proportion of housing that's located near an activity center. So that's how close does where someone live make them to a nearby destination so that they could easily go for that walk right out their front door to accomplish something that they want to do in their daily life or take a bike ride. So that's a key indicator that comes from a broader strategic planning effort in the community, and we've kind of adopted it into our plan. So we're paying attention to that under that improve places goal objective in our strategy. We're paying attention to a number of trail miles in our community. So this is, are those facilities built out to the point where they reach into all the different communities across Thurston County and make it easy for people to get to that place where they can be physically active, taking a walk, taking a run, going for a bike ride, rollerblading, roller skating, you name it. There are lots of different ways to be physically active, and having those trails nearby that are level and accessible and well lit and safe makes it a lot easier for people. So we pay attention to that, and we pay attention to how well connected those are to the nearby neighborhoods, how many little access paths there are into those trails. And finally, we're looking at a longer-term effort to see how well our land use codes and plans are guiding new developments towards that, having a mix of uses and having a good infrastructure built into our neighborhoods and communities. So that's all adding up to, we hope, a strategy that more reliably achieves those long-term goals of a very physically active community because of the way it's designed and built. There are relationships between this and other plans in the community, and in Thurston Thrives in particular, that I wanted to call your attention to. We've had dialogue and connection with a couple of the different action teams in Thurston Thrives. One of those is the Environment Action Team, and an offshoot of that, the Climate and Clean Energy Work Group, because what they're trying to do is reduce emissions and improve our community environment, the physical environment of our community, because that boosts air quality and boosts the direct health impacts of that air quality, and some long-term impacts of climate change emissions. So if we can help people shift their daily movements and their travel to things that are active, it tends to be lower emission things like taking a walk or going for a bicycle ride instead of getting in the car. Likewise, in housing, when we improve places near housing and put housing where there are good places and things for people to go to, that's going to, we hope, bring down cost of living because people will be spending less on getting themselves to and from those things that they need in the community. And it will be also helpful to their health. And so that's going to drive down their cost of living. So that all adds up to better affordability for people in the community, which relates very well to the Housing Action Team's strategy. And we presented last month to the Housing Action Team about our efforts in this in a very similar presentation and was well received there. And finally, in the Education and Resilience Action area of Thurston Thrives, they have a strategy around trying to make more public gathering spaces or civic spaces for people to get together because that encourages people to be connected to each other. They are less isolated because of opportunities to interact with their neighbors and fellow residents. And so that aligns really well with our emphasis on having spaces for the community to use that are good destinations for physical activity, whether that's a plaza or a trail. And so this is some common ground that we have with other action teams that we look forward to continuing to work with them to accomplish. I wanted to call your attention to a couple of things that we've got in an action plan that we've been working on in the past year and will continue to work on through the remainder of 2017 at least. And that includes an effort that has been recognized nationally now that we've applied to be a part of and been accepted into, which is the Healthiest Cities and Counties Challenge. So we're very pleased to be one of the few Western locations where this challenge has a finalist. And we're working on a trail walkshed project as part of that challenge. This is what we proposed, which really builds on our strategy of trying to connect people better to those trails in our community and look at ways to bring access to physical activity closer to where people are living in our community. And so we looked at how can we connect up housing in the community to trails and pathways. So this would also involve identifying, after we do some assessment, since that's a really important first step, is gathering some good information on that, identifying the low-hanging fruit or the really high benefit locations to do some of these new pathways and connections. And we were going to bring that information and some recommendations to other local jurisdictions around the county. We've already met with the City of Lacey about this, and they've been very interested and receptive to that. And that we hope will lead to some of these projects being done, such as connector paths, and new trail facilities and improvements such as benches and wayfinding signage that will help people more readily find those trails and opportunities to be active. And I wanted to show you just a quick snapshot of what some of that data looks like in a story format. I could try to call up the website, but I don't think it would really show much more than what I can present here. Which is just a screenshot of the trail walkshed analysis. And what you see here is the Chehalis Western Trail in the northern section, which actually goes right along parallel to Lilly Road, where the Public Health Department building is in St. Peter Hospital, but also a lot of housing, including senior housing and some low-income apartments. And so this is a prime corridor for people to use for their physical activity, their recreation, and transportation needs. To get to places like South Sound Center and some other shopping areas, as well as other parks, and really can connect them all the way to Woodard Bay in the north part, or all the way down south to the Yelm-Tenino Trail. And so we looked for opportunities along this trail to create new connections and better connections. And what the analysis showed was we can actually find some of those opportunities right behind where we are working over there in public health to build some new ways, more accessible paths to get people to the Chehalis Western Trail. And actually, the city of Olympia is working actively on a project to make this connection happen as we are presenting this here today. They're looking at how can we better the connection for the FERS residents who live in a senior housing complex near this, these orange dots that you see on the trail. But it would really connect a lot of other local residents and employees to the trail system. And just to call your attention to a couple other of the strategies that we're taking action on in the action plan for the next year or two, we're working hard on safe routes to school, and to some degree looking at how do we improve transit stops and opportunities for people to use public transportation, because that does also add up to more activity for people. They have to walk to and from bus stops, and that builds more of that regular moderate physical activity into their daily lives. This is recognized by the Centers for Disease Control and Prevention, which is where this image comes from, as a high-impact strategy. So safe routes to school is well evidenced as increasing physical activity levels among young people, and probably the whole neighborhoods in which those improvements are made. And then also another impact is in public transportation, improving the public transportation system. So I just wanted to let you know that we're following evidence-based practices and trying to bring this to fruition here in our own community. What does that look like? Well, we've been working with Thurston County Public Works and some of the other local governments to identify improvements near school entrances. And this particular image shows some sign and pathway improvements that we were able to do at Nisqually Middle School a couple of years ago. That was with a previous small grant with Safe Kids Thurston County. And then the sort of aerial view that you see there is the entrance to Lydia Hawk Elementary School. And this is where we've been able to identify some sidewalk and traffic calming improvements to make that a safer entrance for the hundreds of kids that go to Lydia Hawk from the Tanglewild neighborhood. That is due to be constructed this year by our own Public Works Department. And coming up, we are excited to be in the running for another grant in Safe Routes to School to work with Olympic View Elementary School, which is just to the north of Lydia Hawk in the Thompson Place neighborhood. And this too is looking at making improvements to some of the street infrastructure, as well as adding some educational and encouragement programs at that school. The principal there is very excited about this, and we're happy to be participating with this to provide some of that education support at the school. And then I'll talk more as we go into summer safety in that presentation about a bicycle helmet project that we're also engaged with through this Safe Routes to School work. That's really a quick summary of what we are doing in the Community Design Action Team and some of the projects. One of our team members is here in the audience, Mayor Pete Komet from the City of Tumwater. If you have interest or questions about some of the things that City of Tumwater is doing and excited about, I'm sure he'd be willing to answer those or provide some more detail about some very exciting projects in improved streets and more trails in the City of Tumwater and other efforts that they're making. But just an example of some of the great partnerships that are happening around Thurston County to make this real and start impacting lives.
Yeah. Mayor Komet, you want to come up and talk about Tumwater just for a second and some of the things you're working on? It's good to see you.
Chris, thanks, commissioners. Pete Komet, Tumwater Mayor.
Can you raise the mic just a tad?
Sure.
There you go.
First, I just want to start by thanking Chris for his great work in facilitating this group. I kind of stepped in halfway in this effort, so I've been trying to catch up. My role has been primarily to help shape the targets and indicators that we're working on to make sure they're real, that they're actually something we can achieve. I'll just say, and for the most part, they reflect what we're already doing, but trying to measure that in a way that we can then reflect on and know whether we're making progress. I think if there is a commitment in this package, it's that one of the things that we'd like to try and do is to try and figure out a way to get the various long-range planning and development review staff together for some kind of meeting, initially just an initial meeting to talk about examples of how they've been able to help influence our development in a way that provides for more active community efforts, as well as some of the challenges they've had and recommendations on how we might adjust some of our codes to try and achieve it. So we're in the early stages of having discussions about that. I think our next step will be to take that to Transportation Policy Board. Commissioner Hutchins will be there and talk a little bit about that, because it involves probably a commitment from Thurston Regional Planning Council. Really, this is all about how do we strategically invest our limited public resources to help shape development in a way that encourages people to be more active in their lives. And a lot of what we're doing in Tumwater, of course, is focusing on the brewery area and how do we redevelop that property or do what we can with the public infrastructure to make that something that will encourage that as a future community center, much like it was, decades ago when it was the heart of Tumwater. People walked to work and all of that. So that's just an example. We're working on trails, pedestrian crossings, sidewalk improvements in that general area, as well as further down on Capitol Boulevard to try and help make that real. So I could go into more detail, but I know you're busy, so I'll just stop there. Any questions?
No, thank you very much for coming
Great.
over.
Thanks. Appreciate it.
No, don't leave.
Okay.
And thank you, Chris. When you were going through all this data and all this data collection, I knew, Mayor, you must have had your fingerprint on this thing, because there's so much data and it's so comprehensive. So thank you very much. And so one of the things that sticks out in my head is the high five, and you have changing the context, making the healthy choice the easiest choice. And I'm one of those 5,000 or 5,100 residents that live within a quarter mile of the trail. But in order for me to ride my bicycle from my house, I've got to go down Wiggins Freeway, and I don't want to do that.
Yeah.
So I've got to throw it in a truck and go somewhere and hope no one's going to break into my truck. They'll know where I'll be gone for a few minutes. And I'm within a mile of LBA Park. So my wife and I would have to get in the car and drive, park, and then go walk. And I would much rather go down to Tumwater, to the Falls Park, and walk in Tumwater where it's beautiful and it's up and down hills and such. But making the healthy choice the easiest choice is key, because most of us will opt out for the easiest path of least resistance.
I'll just give you another example of a simple thing. When we were talking about how to redesign Capitol Boulevard to make it more pedestrian and bike friendly, folks were talking about, I might be willing to take the bus to work, except when I get off the bus, I nearly get killed trying to cross the street the other side to get to my job. So part of what we just put, a sheltered pedestrian crossing with those blinking lights to try and start that process, and we've got some money to do some others. But little things like that can make a huge difference in whether a street is walkable or not. And it's not a huge public investment to make that difference. It's just using our money smartly along the way. So
Yeah, you're right.
I'd encourage you to think about that as you do your various projects for the county as well.
Well, thank you, Mayor Komet. Thank you. Thank you,
Thanks.
Chris, as well.
Thank you, Mayor, and what you do for Tumwater. And Chris, I had a question for you on the Community Design Action Team. Can you just give us a little background on the number of people on the team and when you meet and just the kind of the makeup?
Yeah, we have a core group of about 10 members to the team that includes staff from City of Olympia, staff from City of Lacey, and Mayor Komet from City of Tumwater. The couple of nonprofit organizations that I had mentioned have members who come regularly to those meetings, so Olympia Safe Streets and Woodland Trail Greenway Association. We have other local jurisdictions that occasionally participate in it. Intercity Transit regularly participates. And we try to draw in other participants from parks departments and other local agencies as needed, and occasionally state agencies as well, because they're a partner in our community in terms of how our community is built. And so we not only want their good expertise from knowing project examples from around the state, but also they sometimes have facilities that they are building or modifying in our communities here in Thurston, and that can be very helpful to know and look for opportunities to work with them on those projects.
Great, thank you for that background.
You're welcome.
Anything else for Chris?
Nope,
Are you
he always
prepared?
does a good job.
Thank you.
Are you ready to switch hats? We got a
Yes.
summer safety.
Indeed.
Yeah.
So this next item, summertime safety, is one where we're going to talk to you a little bit about injury prevention.
Okay.
And I'm going to start off with welcoming Marianne O'Garo up here, our
Yeah, sure.
epidemiologist in the Public Health Department. And she's going to share some of the Thurston County data that we have about unintentional injury. And then we'll give you some background on a couple projects that are going on to address that
You
injury
bet.
prevention-wise.
Hi, Marianne. How you doing?
Well, thank you for having me today. I'm Marianne O'Garo. I'm an epidemiologist with Thurston County Public Health and Social Services, as you know. And today I'm going to share a brief overview of unintentional injury. Okay, thank you. In Thurston County, primarily from there's a few different data sources that we can use, but primarily from looking at fatalities, deaths. So you can get a feel for what that looks like in Thurston County currently. Unintentional injuries, accidents, as people think of, is what we consider a leading cause of death. So it's in that top 10 list always. Can move places, but generally is about the 5th leading cause of death in Thurston County when we look at residents of all ages. And when we look at unintentional injuries, accidents, there's a couple things that I just wanted to share with you related to the data that you're going to look at just to keep in mind. Because it can have an impact on planning and other things that you do for any purpose when you look at this topic. One, the data I'm going to present to you today is related to our residents. And I say that from the angle of sometimes, depending on your county, residents come to you. They come to visit you. And as a county, you can also look at the occurrence of accidents in your geographic boundaries. Today, I'm sharing residents. So whether our residents were here when something happened to them or whether they were in Lewis County, so this data kind of reflects wherever they were traveling, whatever they were doing, this is what this looks like. Sometimes when you look a little deeper, for example, I used to live and work in public health in Eastern Washington, and whenever we looked at drowning, we looked at both what was happening with our residents as well as what was happening in our community because we had so many water bodies. So just keep that in mind. Accidents, the unintentional injury component, really means what it says from this angle. This isn't self-inflicted things. This is truly not necessarily that things aren't preventable. There might be preventable components to it, and Chris is going to talk to you about some of those prevention opportunities. But it's those things that there's components of, even though it was an accident, there might be some things that we can do about that. To start with, just to give you a feel for the general numbers, every year, if we look at data for this decade, about 107 county residents die each year as a result of an unintentional injury. When you look at hospitalizations, non-fatal, they didn't die. It's about 1,800 residents are hospitalized every year for an unintentional injury, so the numbers aren't small when we look at that. What I wanted to share with you, which doesn't mean you necessarily have this view, but a lot of people hear this topic and think cars. They think of accidents, vehicle collisions. And what I wanted to share with you is though that's true, that's a component of what is included in unintentional injuries. Really, in this big category, about 1 in 5, 21%, are transportation related. The rest are other things, some of which are preventable. There's some prevention opportunities that you're gonna hear more about. So transportation-related things in Thurston County can include the standard things, motor vehicle related, but we also see some unintentional injuries connected to boating, not drowning, but boating accidents. So just keep that in mind that when we look at those kind of things in Thurston County, It can also be a all-terrain vehicle, transportation-related things that are occurring. When you look a little bit closer and you break it down a little bit further, and you're looking particularly when you're looking at things you might be able to do, though this has happened, you want to prevent future things happening to people along these lines, you generally do want to take a look at different age groups because there's some differences in what happens in those age groups. So I just wanted to share with you, if we break down different age groups in Thurston County and look at fatalities related to unintentional injuries, this gives you kind of the leading components and categories of what happens. So when you look at children from birth to preschool, age 4, before they've gone off to school, what you're most likely to see, this is for this decade, is drownings and suffocation. And so when you think about drownings, a lot of times what gets in the news is the drownings related to cold water bodies, outdoor recreational. But when you're looking at younger kids, you want to think about things like swimming pools. There's different sizes of swimming pools. There's backyard swimming pools as well. You want to think about bathtubs. You want to think about prevention from that angle of the amount of water it takes for a child to drown is pretty small. When suffocation comes up, and most people think of something related to food or, like that parent's worst nightmare at the, snack table. But when you look at younger kids, suffocation tends to be connected to things that even at that time, it's not preventable now, but through education you can improve is things like what's in the bed with the child. Things that, when you think about that, a lot of these are connected to how they're sleeping and what's up against their face and in the bed with them. There's a lot of things that can be done to change that and increase awareness of things people have maybe never considered. When you move up to the school age, 5 to 17, that school age group, you tend to see the motor vehicles. They're occupants in a car. Again, why we care about car seats, and we care about seat belts, and we care about where they are in the vehicle. 18 to 24, so those young adults, you start seeing the list kind of expand in terms of the top things that impact them. Motor vehicle is there. Poisoning begins to show up, and poisoning can be an unintentional injury component. Poisoning is things that involve using drugs in a way, whether it's prescribed or not, that resulted in an overdose. So you start seeing that show up, drowning, and then you see falls show up as well. Falls can be, and people tend to think of falls like older adults, but falls, as you can see, are a consistent issue of concern for adults of many ages. Falls can be your ladder. Falls can be you working on your roof. Falls can be you're on a trail. And so thinking about falls and thinking about fall prevention, there's a lot of opportunities. And then I included other age groups so you can kind of see that by the time you look at 50 and up, falls becomes the #1 area of concern, and those other things show up as well. To go just briefly more into a little bit of that transportation-related component, just so you could get a feel, one of the things that we do so much work around is motor vehicle-related, preventing motor vehicle-related deaths that are unintentional accidents. But I just wanted to show you for Thurston County, motorcycle deaths are a component of what we see as well. So occupant, 62%. Being the persons in the vehicle. Motorcycle, 17% of all deaths are connected to a motorcycle. It has nothing to do with whether they did anything wrong at all, but it is an area, even on the slide that Chris had, one of the things that was under safe routes to school was motorcycle injury prevention as an area where we could do more. And then, of course, the things that connect to what you were talking about, pedestrian deaths and bicycles deaths. We see that, but those changes, those design changes you're talking about can help with that as well. So with that, my time is up, and Chris is going to talk about some very positive things related to this subject. So.
Wait.
Okay, he's asked a question.
Before we get too far.
Yeah.
Is that typewriter, the calculator, that one of the injury causes as well?
No. No. It could be an injury cause, I suppose, but.
But on a serious note,
Yeah.
you had on a previous slide birth to 4, drowning and suffocation, and then 5 to 17, motor vehicle. I understand that. That makes sense.
Yeah.
But I read in the paper anyway, I've read in the paper, where there's more poisonings on the increase from accidental ingestion by children of marijuana products.
So then, one thing to consider, this particular data is about fatalities. And so what you're hearing
Okay,
and
this is about
seeing, so
fatals.
think about that, is
Okay.
that, and so if you were to look at injury, hospitalizations, falls, motor vehicle, and poisoning are the leading reasons why people, they survive, but that's why they're in the hospital. And then there's concern exactly about what you said, about this then moving into,
Okay, because the previous slide I
Into
looked at
other-
said unintentional injuries, and so I was
Yeah,
equating
sorry,
the two, but
fatalities,
got it now.
yep.
Thank you, ma'am.
right, yeah.
Thank you, Mary Ann.
Yeah, that's why we definitely do not want to see that move into this area, so, yeah.
Anything else?
No, thank you.
Okay, thank you.
Chris, you had something?
Safe kids.
We're fortunate to have in our community the Safe Kids Coalition with Child Care Action Council, and our department partners with them to do some efforts around injury prevention in the community. And so they prepared a few slides that I just wanted to show you about their areas of concern as far as injuries, and particularly for child injuries and child fatalities in the community. It's a very serious issue, obviously, and one that we need to be doing things about. So because unintentional injuries are a leading cause of death for the child age group, so birth to 18. And you can see there are some statistics about that, that there are a large number across the country who die each year. So most of these stats that you'll be seeing are ones that are national in nature, but they did try to pull some local data as well. So it is causing a fair amount of unintentional injury in our community, some of these things that Mary Ann has mentioned, and there are some things that we can do about that. And this just also indicates that whereas some of the factors in early death in our community or communities across the United States are being driven down, some of those chronic disease-related factors in death, unintentional injury resulting in death has been going up at least in that span from 2000 to 2013, I believe, is what they were looking at for this data. So one of the efforts that Safe Kids has been involved with is bicycle and wheeled sports safety in the community, and this is a contributor to those unintentional injuries. One of the things that has been a focus of those efforts has been to provide bicycle helmets to kids in our communities so that they have a preventive tool to use that's fairly easy to use that helps them avoid some of the more traumatic injuries from a fall or from a collision while out there on a bike or on other wheeled kinds of sports like a scooter or rollerblades. So it's an item of personal protective equipment that's fairly easy to put on and get out and fit properly. And Safe Kids has been doing a great job with that over the last several years. And just this year, they were a recipient of a Transportation Alternatives Program grant from Thurston Regional Planning Council that has allowed them to do a major distribution effort in partnership with Intercity Transit and our department and the local schools, to the point where we've been able to distribute bicycle helmets to 36 elementary and middle schools around Thurston County, totaling close to 500 helmets have been put out there, and I think all school districts are participating in this across Thurston County, so all 8 school districts have been a beneficiary of this, and the school kids that they serve have been taking these helmets home and are better prepared to enjoy an active summer on their bikes. And so that's a great thing that we've been able to do this spring and that we hope to continue in the future as part of a broader Safe Routes to School effort. So this is at once encouraging more physical activity, but also making sure that it's done safely, because helmets are one of the great ways to prevent some more of the serious injuries from wheeled sports. And in the area that Mary Ann also mentioned, drowning, frequently this occurs in swimming situations, outdoor recreation situations. Think lakes, rivers, Puget Sound, the ocean. being particularly risky for drownings, but it can happen in more everyday environments as well, swimming. So there are some preventive measures that people can do to keep themselves safe in swimming environments. One of those is to look for those posted public health advisories to guard against exposure to contaminants that might be in the water. And then some other steps that people can take are looking for the available safety equipment that might be at a public pool or a public beach, and look around them, the area that they're going swimming, for other hazards that might pose some risks when you're in the water, such as trees or other underground, under the surface kinds of obstacles. Always closely supervising children is a pretty important part of preventing injury or drowning in the water. Don't drink water that you're swimming in would be a pretty basic form of advice that we would give from public health. And never swimming when ill with diarrhea or having open wounds, because that can spread disease. Learning to swim, swimming with a buddy, these are pretty important steps. And then a program that Safe Kids is doing, as I scroll through here, is to provide Coast Guard certified life jackets at various locations around Thurston County and public boat launches in particular, to encourage use of those when people are going out onto the water in watercraft, because that's another way that accidents and drownings can occur. So there are these options out there in the community now. There's a list of all the different boat launches and other public locations where there are those life jacket loaner stations. So that's a couple of things that can be helpful, hopefully, to families as they go out there and recreate this summer or near water. And then finally, there's another effort that Safe Kids has been involved with, and a number of other partners, which is firearms injury prevention. And so this gives some of the stats about the impact of firearms on our communities, and that they are a contributor to unintentional injury and deaths, including those with kids. And there's fortunately some efforts going on to address firearm safety. Keeping our families and kids safe from firearms involves storing them safely, locking them up. I don't know, Marianne, if you wanted to come up and speak to the efforts related to this firearm safety event, but I can address it really quickly. That Cabela's is hosting a gun lock giveaway, gun storage giveaway event coming up on Saturday, June 24th from 10 to 1 at the store. And this is something that our department is participating in, as well as a number of other local partners that you can see listed here. Thurston Gun Sense, who you heard from earlier this year about suicide prevention, is involved with they have a gun safety subcommittee. And Seattle Children's Hospital is really the statewide organizer for these gun safety events. And they've been doing this in a number of other communities around the state. So some great partnership occurring to put on this event, and I believe the Thurston Gun Sense is also doing a similar gun storage safety event in the middle of July. So that's coming up, and we'll be getting out the promotion of this event as an opportunity for kids and families in our community. And just a couple other quick things about safety and injury prevention. It does have a big impact socially in our community. We want to make sure that all kids have equal opportunities in our community to be safe and healthy. And so taking some of these preventative measures and helping those in need can really reduce some of the incidence of these safety problems in our community. And they have a big payback. Investment of $1, as you can see from these stats, adds up to a lot of savings in health and safety related costs. And just a couple final notes of summertime safety that I wanted to bring up are that it's sunnier in the summertime, and so protecting yourself from the sun while outdoors in the summer, being active, is important. Using a sunblock, SPF 15 or higher, is really important. Covering yourself when you can to keep that sun off your skin is a good thing. And then obviously taking care when recreating and hopefully not doing so, or traveling and operating a vehicle when impaired, by drinking alcohol or using other substances. Obviously, a main recommendation in terms of preventing injuries and traffic fatalities. Along with that, not driving distractedly. So hanging up the cell phone or the other personal mobile device is really important to keeping our streets safe and protecting kids in our community. So with that, I'll conclude and just say, be safe and be active out there, and hope that that folks will take some of these messages home.
Any comments, concerns?
Another good job by Chris.
In his bite?
Thank you.
Yeah. You want to go first?
Yes, please.
Go ahead.
I just wanted to add one other thing, which is that adolescents and young adults may not realize the temperature of the waters that they're swimming in. It may be hot outside, and the water can be so cold that soon your brain isn't working very well, and drownings can happen from that. So please be careful.
Thank you, Dr. Wood.
Well, when I knew we were going to be doing summer safety, I expect to hear the SPF and the EpiPen and the water temperature and personal floating devices, all those types of things. But I really like that you put in there about the firearms. Because in 35 years in law enforcement, I don't know about my seatmates, but I've responded as a first responder to numerous child or young adult injury or death involving a firearm. And I wouldn't wish that on anybody to witness that, let alone the mom or the dad or the siblings. And it was 17 years ago this week where my son lost a good friend to a firearm death. And it's shocking and tragic. So I'm really glad that you included the firearm safety. Thank you, Chris, very much for that.
Very welcome.
I just have an additional comment. Reflective gear, when running and all that is, I was going down a road the other day and I saw a guy come through the underpassage. I didn't see him. Actually, he was under there, the shadow portion of it. And as he come out, I'm still a good 200 feet away, but I wish he had a reflective gear on so I could see him while he was under there. But then he kind of jotted out of there. But just that kind of stuff helps out a lot.
Absolutely, and that's something that people probably take a little bit for granted during the summer months when we have longer daylight hours, that,
Yeah.
oh, I'm going to be fine, I'm perfectly visible when I'm out there. But we do still have a lot of overcast conditions and rain, and often people are out there in the early part of the day or the late part of the day in their lower light conditions. So it's very good advice to keep yourself visible, wearing brightly colored clothes or using reflectors or lights as needed.
Sure.
Thank you.
Okay, and so I think we're transitioning to the next item, and I think you're going to introduce it to fatherhood and community health. Is that correct?
That's correct.
Yeah, go ahead.
Right. So it is the month of Father's Day here in June, and I believe that is why we've got this coming forward to you. And we're very lucky to have with us today presenters from Family Education and Support Services, Howard Winkler, who is a program manager for the Father Engagement Program of Family Education and Support Services, to share about that, the impact of fatherhood on kids' lives, and some opportunities about that.
Yeah, that's great.
Welcome Howard up to the mic.
Come on up, Howard. Do you have a slideshow also?
Pardon me?
You have a slideshow also?
I don't know if we're on the slideshow. We do have a handout.
A
Chris,
handout?
do we have?
I'll grab that handout.
Okay.
Yes.
Sure. That's all right, yeah. Go ahead, Howard, you have the floor.
Well, I'd like to begin by saying thank you to you Commissioners Blake, Edwards, and Hutchings, and thank you, Chris, for the introduction. And also the county staff present and the other fellow citizens of Thurston County for this chance to share our efforts to serve the families of Thurston County. Off my script for a second, thank you. When I walked in early today, because I go to meetings early because I'm paranoid about being late, and I was greeted by several people, and I really appreciated the fact that I don't know how many counties you can walk into and you get a handshake and, hey, how you doing, instead of who are you. So thank you for the comfort that offers. My name is Howard Winkler, and I'm honored to present represent Family Education and Support Services. I speak on behalf of both our director and founder, Shelley Willis, and our Fatherhood Engagement Coordinator, Keoki Kanoe. In referencing Family Education and Support Services, I will reference it under the acronym FESS for FESS for brevity. I will say this too, normally when I speak on behalf of Shelley, she's not in the room, so this will be fun today because she is also present. I've worked for FESS since 1995. I've been a citizen of Thurston County since moving here with my family in June of 1977. That's 40 years ago this month. Yeah, wow.
Yeah.
So much happens in 40 years. And as part of trying to connect, because I haven't known you gentlemen much ahead of time, one of my perspectives was that's so long ago, I think, that Commissioner Edwards, that's before you were even elected sheriff.
But I was out working the road.
Fortunately, we didn't meet under any challenging circumstances. Thank you. Commissioner Blake, I'll repeat as I did earlier, that our office, we have a wonderful woman named Tanya. Who She said to send you greetings and a hug. And Commissioner Hutchings, we did actually meet briefly during the last election. And in fact, I have 2 of your yard signs still in my garage. And actually, one's on the ceiling covering a repair that I had to do to the plumbing. But, so,
Good thing I printed on both sides.
thank you, and for making me welcome. Is that my advancing? Oh, boy, okay. I'm in control.
Okay.
FESS was created and exists to serve children by offering education, classes, and seminars, and support groups to those who parent them. Shelley Willis, our director, started by offering many years ago first 4 classes and then expanded to 6 each month. We're now in our 23rd year. We offer over 60, that's 60, facilitated classes and groups each and every month. They range from 90 minutes to 4 hours, and they are always hosted by a professional facilitator. So over time, things grow, including our efforts. Of the 68 events we're hosting this month, 25 of them are focused on serving dads and fathers. As I offer you some details about our efforts to serve the dads, it's not lost on me that I'm speaking to a panel of dads. And when I talk about our programs, my perspective is not really about those dads, but it's rather about us dads, because I think that's really where the conversation needs to go and stay. So I'll refer you to the overhead and try and follow myself here, and assuming that the right click is the advancement. In the overhead, it says, children need their fathers and fathers need their children. Isn't it amazing the things we say that we should never have to read as new information, right? We all know that. And so, but that happens to be the title today. Our Father Engagement Program at FESS strives to improve the lives of children by promoting healthy father-child relationships and increasing positive male involvement. Our evidence-based approaches include the award-winning Nurturing Father program. When we first started the program, Nurturing Fathers, in 2003, we didn't call it Nurturing Fathers because we didn't think the guys would come. So we called it Dynamic Dads. And they came.
There you go.
Yeah. So, but it is that manual that we use and honor its wisdom as we progress through the class structure. Nationally recognized Bringing Back the Dads is a recent add to us, and we use the Parents Anonymous Support Group model as a key element in terms of how we handle the flow of information and always show respect to those who are participating. Our services exemplify the honor, integrity, and value of the role of fatherhood. Fathers are role models, heroes, counselors, guides, truth tellers, providers of principles, morals, and values. And when fathers are not there for their children, the outcomes can be, unfortunately, disastrous. You know, on this slide, this page, rather than for me to read to you the percentages, which are pretty impressive, under the effects of growing up on fatherless, I'd rather call your attention to what the percentages are relating to. We're talking about suicide, homeless, and runaways. We're talking about behavioral disorders and dropping out of high school. We're talking about incarceration and substance abuse. Those are heavy, heavy outcomes for children. And so when we talk about this, we're talking about the impact it has if the father is not engaged with their children in the ways that would benefit that child. The facts regarding the phenomenon of fatherlessness, they score lower than the normal reading and math tests, twice as likely to drop out of school, 11 times more likely to exhibit behavior. By the way, I didn't create these numbers. They're quoted from the National Fatherhood Initiative, who apparently did this survey. 72% of teenage murderers grew up without a dad. And so, that, I mean, how sad. 70% of the kids now incarcerated in juvenile corrections were without a father. 80% of adolescents, psychiatric hospitals, half of them are more likely to marry as teenagers, and 92% of girls are more likely to dissolve their marriage. I apologize for reading an overhead to you, but it is the presentation. 5 times children from fatherless homes, 5 times more likely to commit suicide. We're talking, again, here's just the multiples. We're revisiting the earlier page, dropping out of school, again, incarceration or needing services, behavioral health disorders, even runaways. Here would be the benefits: children raised with involved fathers. They're more likely to enjoy doing well, have positive attitudes about school, to participate in extracurricular activities, do better with their studies, better problem-solving skills and stress management, and actually a better overall life, I guess I would say. Before I go to the comments, let me just add to that last sheet. The choices we make directly affect our children. Our job in fatherhood engagement is to purposely define those choices so that men can be the dads that their children deserve, which is the best dads they can be. Many of these men come to FES with their sense of fatherness degraded. They may have been told they are not needed, or maybe their own dad wasn't around and they have no role model. Or they were better off without the role model that they had. Whatever the case may be, they believe they aren't important and haven't been told how vital they are for their kids. Once they see that they do matter and are a vital part of their child's life, we see so many men move on with purpose. I think one of the things, if I were going to expand a little bit, that would come to mind is that piece that sometimes men are told, go away or we don't need you, and they buy it. And we won't go into all the details that might lead somebody to say that. But the reality is the kids need a father. And so a lot of these guys, once they think about it, they will show up, whether it's at school or time with a child, perhaps through a parenting plan or whatever it is, they show up. Not to serve their right to their child, but to serve their child's right to them. And that actually formats a lot of what we look at. Is we're not father advocates, we're children advocates, on the basis that they're entitled to the loving, caring, safe arms of both parents. And so we try to keep that as our major area of focus. So when we began Dynamic Dads in 2003, I did the classes for about the first 6 or 7 years and graduated 100 plus men. Kawanoi has taken over the program in 2009 or 10 and has actually just about doubled my numbers and has graduated now a grand total of the program. We're approaching 500 in that time period of graduates. And so I'm very proud to have been a part of the program. I still stay connected with it for special events, including talking to you today. And if there are any questions or comments, I would certainly invite that.
You got a comment about fathers?
I don't know, I'll get repetitive, I guess, but anytime you're dealing with kids, 30% of our population, 100% of our future. And we really can't put enough into it. We better get it right.
Yeah, thank you.
To include dads.
Yeah, I mean, they need a dad, yeah, those kids. So thanks a lot, Howard. Good job.
Well, thank you. Before I depart, I've been asked to also make sure that we share with you an upcoming event. Let me find it here. Shelley, maybe you have some handouts on this. There's a conference coming up on resilience on June 21st that we are co-sponsoring over at the ESD, and so we want to make sure that that information gets out here as well.
You know, Howard, I've had a lot of titles throughout my profession, and even since January, I've been called a lot of things. But I'll tell you what, the most proud title I've ever had is that of dad. So when my son or daughter call me dad, I reach out to dad or grandpa, or actually it's opa. It's exceptionally meaningful, exceptionally. I wear that very proudly. So thank you. I never heard about Fest before, so thank you for doing
Well,
this.
thank you again
And
for the
Shelley.
opportunity. You know, gentlemen, it's not lost on me that all of you have worn a uniform. And along with that comes structure and a sense of dignity and how you conduct yourself. And a lot of the guys that we get to deal with didn't have that kind of discipline or structure, and they're not bad people at all. They just are missing that piece. And when they get to talking about it and become self-empowered, they step up.
Mm-hmm.
They step up. Never met a dad who didn't love his kids. Maybe I swim in tight circles, but. Yeah,
But thank you, Shelley, as well, and Keoki.
Oh, the 10 ways to be a better dad? Okay, all right. Oh, that's on here, isn't it? Yeah. There's some of the comments here, by the way, too. I guess I kind of wrapped up without doing that. I won't take more than another minute here. But let me just read that first one. Doing my job in the military out there is so different from being a dad back here at home, and this class has helped me to transition from the battlefield of men to the ball field of my kids. I actually got to meet that the guy who said that, I think, a couple weeks ago. Let me read the one more. I came here angry and upset. I didn't want to be here. I didn't need to be here. But watching you come here, doing the work, talking to each other, working it out, I want to stay and learn so much. Now, not only do I know how to be a good dad, I actually get along with my ex. I just didn't learn about being a good dad, but how to be a good person. So, I mean, good for all of us when we do that. There is on the back of the handout some 10 ways to be a better dad. I'd really rephrase that to here are 10 habits that successful dads do, as opposed to an instruction. And respect for the child's mother. You notice that's first. We live in a place where the divorce rate's 50%. So there's a lot of the differences that come up in that. And that respect, please believe it or not, we go there, and rightfully so. So it's time with the kids, listening instead of talking, being their teacher, being a role model. What an honor to have that assignment.
Yes,
as you
it
said.
is.
Okay, I better stop. Thank you.
Yeah, Howard, I'd like to thank you and Shelley for what you do, and all the FEST members, a critical asset to this community. I've been there several times, and I know you change people's lives in one way or another, not only through Father, but from families and other programs that you represent. And I look forward to being at the Resilience Biology of Stress
Join
and the
us.
Science of Hope on the 21st, and continue to do and the good job that y'all do. Thank you, Shelley.
Yeah, thank you.
Okay, we're going to move into the director's report, and ask Shelley if she has anything on her mind she'd like to share with the public.
I do. Good afternoon, almost evening. I just had the honor to return from the Washington State Local Public Health Officials Conference last week, and this is a gathering of all the local health jurisdictions in our state, along with the Washington State Department of Health. And one of the key messages that I want to bring back here is that public health is essential. And that's why I'm wearing this very fashionable button today. You too can have one.
Oh, she's got one too. Up here.
Department of Health Secretary Dr. John Weisman and I were recently featured in an Olympian editorial that ran just this last Sunday, discussing how critical our public health system is and how we do not have sufficient funding to carry out our core responsibilities to ensure that the public is safe and healthy. And I know you've heard about a little bit about this before, but I just think it's so important that I really want to share it with the community. So the problem is that there's an increasing demand for the services that we offer here at Thurston County Public Health. And our population is growing. So we have over 250,000 people here in this county, as you all know. And we've had a 12% increase in the population and nearly 50% cuts in health department staffing and programs. And that leaves us too vulnerable here in Thurston County. So foundational public health services include things like ensuring we have resources to respond to emergencies and public health crises, like some we've talked about today, and also to prevent some of the things that we've talked about today. So we need to be able to quickly and effectively respond to, prevent, and follow up on things like disease outbreaks, such as tuberculosis, which Dr. Wood's going to talk a little bit about in her report. We've had big increases in our state in syphilis, HIV infections, hepatitis C. Then there's been new things that have been new to us to respond to, like Zika and Ebola, that have come with all the travel in the last couple of years. So measles, the flu, E. coli, there's always something. So we're really fortunate that Thurston County is ranked the 7th healthiest county in our state. But when you look really close, there's some key gaps, and those key gaps are tied to the social, economic, and environmental factors. So we're having to be reactive instead of proactive and preventive here, and that's also much more expensive for everyone. So this is the first generation of kids in 100 years in our country who will have a shorter life expectancy and worse health. So we don't want our citizens to have to worry about, is their food safe? Can I drink the water without getting sick? Will my baby be born healthy? Will I live a shorter life if I live in 98532 versus 98502, so Rochester versus Olympia? So we should be able to take care of those things in our public health system, but we can't right now to the fullest extent, and that really puts our community at risk. Our recent toxic algae situation that you heard our report on today at Summit Lake really highlighted for me and for us just how fragile we are, and we need to ensure that we have the capacity to do our jobs well for the public and handle multiple crises and events at once, as well as do the normal work that everyone depends on us for. We also know that regional collaboration, shared services, and modern technology is very important to carrying out our work to improve the health of our communities. So we're hopeful that the state legislature will fund foundational public health services this session. They have a lot of important issues to consider how to fund our education system, but we hope that they'll make investments in kids, because kids can't be ready for kindergarten here in our community if they aren't vaccinated, haven't received health screenings, weren't born healthy, or they're missing school because some of these diseases, or they don't have healthy parents because their homes aren't healthy, or they're sick or have asthma and lots of other things like that. So if the public's interested in learning more, they can visit publichealthisessential.org. That's an easy one to remember. And I talked just now a little bit about how important kids is to us, and so did Commissioner Edwards. Promoting the health and wellness of children and families is one of your top priorities as Board of Health. I know it's one of my top priorities. And so we continue to engage in our local collective impact efforts, such as Thurston Thrives. Really glad to be a sponsor also, or partner in that event that Family Education Support Services shared with all of us. We're engaged in our local accountable community of health, the Cascade Pacific Action Alliance, and we hope to expand programs such as our Nurse Family Partnership. You heard about that at our last Board of Health meeting, and I'm very proud to share that since that presentation that you heard last time, our Nurse Family Partnership program has been recognized by the National Service Office as one of the highest performing, and because of our success, we're one of 7 in the whole nation that's been selected to participate in a pilot program to serve women who have more than one child. Our current program serves first-time mothers only, so we're really excited to be selected for that opportunity and see what comes out of it. In other good news, we're invited to apply as the lead applicant for the 7-county region to apply for tobacco vaping prevention grant through the Department of Health. We have a rate of tobacco and marijuana initiation among youth that is higher than the state average. A lot of people don't forget about that, about tobacco. So our tobacco, we had a tobacco and vaping forum that Chris told you about last time. That was very successful. It was well attended, and we're really glad to be partnering with ESD 113 and Choice Regional Healthcare and all of our other local partners on youth marijuana, tobacco, and vaping prevention efforts. So this week, on that similar topic, there is a delegation of us from Thurston County attending a summit on reducing the supply of illegal opioids in Washington. So that's heroin and illicit prescriptions. So I'll be attending along with Dr. Wood, Commissioner Blake's attending, the Thurston County prosecutor, and some more staff from their office, and then local law enforcement are attending together to learn best practices and innovations in prevention and response efforts that we can bring back to this community. Statewide, there's been a 31% increase in overdose deaths. So we're very concerned about this trend, and we want to get ahead of it here in Thurston and prevent those deaths because they are 100% preventable. In July, I won't be in attendance at the Board of Health, along with Commissioner Blake and our partners at Department of Health and King County Public Health and some others in our state and region. We will be attending together the National Association of County and City Health Officials in Pittsburgh, and we're looking forward to bringing back those national best practices, innovations, and the latest research to improve our health here in Thurston County. And finally, I just want to come in and thank a few people here today. The staff at my department, you heard today in the beginning our environmental health division, and we are 5 weeks into of incident command for the Summit Lake, and I have just been so impressed by the amazing work that everybody has put into it. It has taken a lot of energy and care and lots of extra time, and it's just been not just in environmental health, but the whole department has pitched in to kind of help during that crisis. And so I just really appreciate how well they have handled this. Chris, you deserve a special award for just being back-to-back on all this, and we can always rely on you to do such amazing presentations, and Marianne, you as well. Gosh, I hear every day from everyone in the community about how important the data and information and the work that you do to partner with the community to bring attention to these important things is so critical. And our nonprofit and government partners, you know, Mayor Komet left, but we have lots of government partners from other jurisdictions, as well as within Thurston County that work together on all these efforts, including Thurston Thrives and all of our action teams and our nonprofit partners, such as Family Education and those who are here today, all work together so amazingly well to make Thurston County a place that I'm really proud to live and work in, and that's part of our goal, to have a safe, healthy place for everyone to work, live, and play. So thank you so much to everyone.
Nope, all sounds good to me.
Okay.
I just can't believe how much work is going on at PHSS. Oh, my goodness, it doesn't stop. So thank you, Shelley. Doctor.
Yeah, congratulations to Nurse Family Partnership, the grant recipient piece there, and the partnership building that continuously goes on at all levels there at PHSS. It just goes to show how health is in every single thing you do, whether you're sleeping, eating, driving, even watching a football game. You got to be healthy in order to do it. It's more than just a broken arm or cut on you as far as health. Health is in everything we do, and y'all do it the best at PHSS. So thank you so much.
Thank you.
Dr. Wood, now the good stuff.
Thank you very much. It's always a pleasure. So I also was at that Washington State Association of Local Public Health Officials meeting and had the pleasure of getting to spend a little bit more time with Shelley, which was just delightful. But I wanted to report out on the health officer meeting. It's always an honor to meet with my colleagues from the other local health jurisdictions. I wanted to highlight one thing. I see my role as is bridging between public health and my clinical colleagues, the physicians who are in the trenches taking care of sick individuals, as I like to think that I'm trying to keep populations healthy. So last year at the Wasalfo meeting, the Washington Academy of Family Practice sent some representatives, and a group of people paired up, and there were many people in the room, and they came up with 2 areas that were low-hanging fruit that both family physicians and public health could work on. Number 1 is immunizations, and the other one is the opioid crisis. So we're all the efforts that we're all putting in, from law enforcement to family physicians to public health. And I just wanted to say that the health officers have been working on that and highlighting, educating their colleagues, and working with developing guidelines for prescription practices, including with our dental colleagues. We also are working with the State Department of Health with the prescription monitoring program to get provider-level data on prescriptions, and finally, to expand access to treatment and have more people get trained with Suboxone, which is a sort of a responsible, if you have the chronic disease of having addiction, it's a responsible way of trying to move forward with your life. Other things the health officers spoke about are crisis standards of care, which is always lurking in the back. We're American citizens, and we think that there's always going to be every medical device available for every eventuality, but in a pandemic, there may not be enough ventilators to go around. And so there are standards of medical care, and then there's crisis standards of care. So the health officers talked about that. I want to let you know that I, again, am having the honor and pleasure of precepting a medical student. Thank you again for signing, giving me permission to sign a contract. I wanted to report, as you know, we take the job of protecting our public from tuberculosis very seriously. I want to report a graduation that we're very proud of, an individual we've become very fond of, who has been on TB treatment for 18 months. And our community health nurses have been doing directly observed therapy on that individual for 18 months. Some people have to be on treatment for 18 months for tuberculosis. We also had another individual graduate after 6 months on TB treatment, and we still are continuing to monitor other individuals. And then last of all, I just wanted to say we still have rabies in this country, and in the state of Washington, it's most likely related to a bat exposure. And so I want to thank the environmental health staff that field those calls on a regular basis and get anxious parents and their children hooked up for post-exposure prophylaxis if that's indicated from exposure to a bat. Thank you very much.
Wow. How about you?
Good grief.
On that bat issue, is it's more prevalent than this time of the year when the bats are out and active? Is that what's going on?
Oh, I could talk a lot about this. Yes, that's exactly it. And also, if you want to prevent bats from getting into your house, it's best to seal up the entrances to the little, I think they're called soffit joints, at the end of the summer season. Because right now there may be babies in there, and you don't want to seal them up, and then the babies are sealed in there. So like September is a good time to seal those up. But, you know, sleeping with screens on your window, if possible. I realize that's not also. A lot of these exposures, people go off for a happy weekend in the mountains and sleep in a cabin, and then they wake up and there's a bat flattering around. And if you can capture it safely without getting bitten or anything, unfortunately, the bat needs to lose its life so we can test its brain and make sure it doesn't have the rabies virus in the brain. And if we can find that for sure, then we can say that you don't need the post-exposure prophylaxis. And I could talk a lot about that, but thank you.
How about you?
No, it just doesn't stop. It just doesn't stop.
You didn't want to be Batman, huh? I had nothing. You are absolutely wonderful for what you do at Thurston and Lewis County, and I appreciate everything you do, Dr. Wood. Yeah.
My honor and pleasure.
You bet. Any other final comments? Is there a motion to adjourn?
Mr. Chair, I move to adjourn the Board of Health meeting of June 13, 2017.
I don't think we failed, I think we failed to tell Mary Ann she did a good job too, though, because she always does. And I'll second that motion.
It's been moved and second
Yeah.
to adjourn. We are adjourned.